Hello, I'm Dr. Richard Okoye, and I'm here, please, to ask you to support us to save the life, the quality of life of these innocent children having different conditions for which most time, out of lack of knowledge or desperation to see them, I can't just see my baby, growing up this way. Please pause and get a knowledge, and most importantly, share this to every loved one of yours so that we can preserve the future of the children. You must have seen children with this kind of legs, and both the one, the care leg, leave the big grammar, the care leg and the bow leg. Some will even come up with this, and you keep wondering, what should be done? What can we do for them? As a matter of fact, you can see ladies that used to have very beautiful legs. Lo and behold, you see a lot of women now today, everybody's wearing masks, they're covering the legs. We know what is there. Very painful to tell you that even sometimes the husband can't talk, because if he say anything, woe unto him. So he will keep, even when the leg is scared, like he will say, baby, you are too fine. Look at how straight the leg is, because he's trying just to save his face. But this thing happens even when people become adults. You see some of them moving like chimpanzee. Some of them, with the care leg, with bow leg, and with pain. You can't imagine. Now, let me be in position to advise you, particularly for those with children. Please, when you see children with this type of condition, bow leg and all that, do not force them to go and do any surgery. Please, do not advise for any surgery, because within that particular first year, some of these cerebral from childhood could be physiological. So you do what is called bracing, just to ensure that you try as much through bracing for the leg to be able over the time. But you gotta be patient, because sometimes it may take 1 year, 2 years, but you may get significant correction. Do not think of surgery for that child, because the child is still growing. When a child is born, like in the case of blunt disease, you know what happens there? The growth plate on the inner side of that very leg is growing faster than the outside. So as it's growing faster, all of a sudden it goes this way. Do you get that? So that's what happened. So when this child is still growing and you go and do surgery, after it will grow back again in the same pattern, the leg will burn. That's why so many couples and so many parents are living with pain over the state of their children, having done surgery upon surgery. Please pause. Let me give you the right thing you should do. When you see that kind of case, from that very age to 11, do nothing. Do nothing, okay? Today, there is a particular, though it's a big grammar, but just keep it by the side. It's a procedure that is called hemiepiphysiodosis. Please leave the grammar. That thing is just like a growth modulation procedure. What does that mean is that this particular leg that is bowed, the growth plate on that particular, there's a procedure that will be done on that plate. It won't be growing again. So that this one that is growing slowly over time will be able to meet up. But after that is installed, every 3 months, 6 months, that will also be checking. You can see the leg gradually until eventually it grows. So that's why from the age of 11 to 13 is the most appropriate time to do this type of procedure. And most importantly is that there should be 4 years, 3-4 years before this child stop growing. So that by that time this is growing, that very child can come out. And because of the nature of its procedure, the issue of all the complications associated with major surgeries will also down. And this very person can finish and be made to go back as quickly as possible. All right. So that is one of the things I want to encourage you. And checking out some of these women with this type of stuff. Come on, let me tell you something. This thing you see is usually caused by arthritis, osteoarthritis of the knee. Today, with what is called painless and minimal stitch, knee replacement surgery can be excellently done. You know the beautiful thing about the latest technology on it? This particular procedure, the patient do not need to sleep anymore. Before this time, we'll be asked to do one side and 3 months after come back and do another one. No. Today, both can be done simultaneously. Patient will be awake and 1 hour 30 minutes if it's a fat person, or 1:15 or 1 hour 30 minutes, the 2 procedure will be over. 5 hours later, that person should be able to change the leg. The next day can be made to start walking. The same thing is also applied to people that have spine problem in that particular line. 6 hours later, this person can be made to stand. These are some of the things that technology has been made available. Even today in Nigeria, you have a number of centers that you can still get the best in this country. Ignore whatever anybody tells you. Oh, Nigeria is so miserable. Good things are still happening here, and more will still happen when we get more committed to develop the healthcare system of this country. Okay, most importantly, consider the children. Let nobody mess them up within that particular year. With bracing over the years, it could be better. But whatever happened, at the end of the day, you could still be in position to do growth modulation procedure for them. For adults, knee replacement, painless and minimal stitch, you can still bounce back again without pain and with straight leg. It's possible in our time. Please endeavor to share this knowledge to everyone you know. Let's preserve the future of the children. Okay? God bless you.